I'm going to talk about adult survivors and how I feel that a trauma-informed approach to care and practice would make all the difference in the world. So as a group, adult survivors of childhood trauma in Australia have repeatedly been ignored in terms of mental health policy and in terms of service delivery. And the reasons for this are many and varied. Factors include the stigma and taboo about abuse, and if you're a survivor, you know that only too well. Talking about abuse is the perfect way to clear a room. The collective denial around the scale of the issue, and we know that in Australia, by conservative estimates, there are more than 2 million survivors, probably more like 4 to 5. In this room of 250 people, there's probably at least 60 survivors, if not more. And of course, the other issue is the complex needs of survivors. And sometimes the failure to acknowledge those needs is absolute pure ignorance. We know from so much research that adults traumatised as children or as adolescents suffer severe, persistent mental health, physical health, social, behavioural and substance abuse issues. But despite the research, that hasn't translated into policy and planning, and that is simply appalling. There remains a prevailing attitude that adults should simply be able to get over it, get on with it, all by themselves. The good news is that people are resilient, and with the right help and psychosocial supports, adult survivors can find a road to recovery. But the sad reality is that this resilience is repeatedly tested by the appalling lack of investment in this country in a trauma-informed approach to care and support. Okay. Let's just define trauma-informed care and practice and put it in context in relation to adult survivors of childhood trauma. Trauma-informed care is a strengths-based framework that is grounded in an understanding of and responsiveness to the impact of trauma, that emphasises the physical, psychological and emotional safety for both providers and survivors, and that creates opportunities for survivors to rebuild a sense of control and empowerment. And a lot of this resonates with many of the speakers from this morning. So it's good that we're all singing from the same songbook. The majority of survivors today cannot access and afford to sustain the services they need. They need holistic support to make sense of their histories and to find a road to recovery. What's more, few service systems or workers have the insight and awareness to appropriately acknowledge and support survivors and their fundamental needs. These collective failures repeatedly compound the needs of individuals and the challenges of families and communities. So all trauma has the potential to invoke fear, helplessness, loss of control, horror, terror, to overwhelm coping mechanisms. But the trauma on which I'm focusing is the trauma of emotional abuse, physical abuse, sexual abuse, neglect, what the child doesn't receive, and violence in the home and family. And often victims of abuse experience several forms of trauma concurrently. While individuals and society's reactions to trauma vary enormously, the trauma of childhood abuse can be especially damaging. And there are many reasons for this. During childhood, the brain grows and develops very rapidly, especially in the first 3 to 5 years, and then again at puberty. And it continues to develop until a person's in their 20s. During this entire period, trauma can affect the neurochemical processes and the growth, development and structure of the brain. The trauma of childhood abuse is rarely an isolated incident. It's commonly repeated, extreme and prolonged, characterised by a series of traumatic events starting at a young age and disrupting the earliest of attachments. Its effects are all the more pervasive because children are young, innocent, and developmentally immature. It's also interpersonal. It's perpetrated by one human being on another, and often by the very people charged with the child's care, the people that should be able to nurture, protect, and keep those children safe. For all these reasons, childhood trauma is much more likely to cause global consequences than trauma experienced in adulthood. The criteria for diagnosis of PTSD was developed to describe the trauma post-war experience. And it features a triad that we all know pretty well: the intrusion of re-experiencing of traumatic memories in nightmares and flashbacks. And for anyone who's experienced a flashback, they're absolutely terrifying. To be thrown back to the age of 3 or 4 in a state of abject terror, to not know what's happening to you, to not have the words to describe it, to have the physical symptoms, but no narrative around it. The hyperarousal, hypervigilance, emotional numbing and avoidance, and that also includes traumatic amnesia. So the characterisation of complex trauma in terms of PTSD alone and the service responses based solely on that diagnosis failed to capture the pervasive impacts of childhood trauma. Without the security of a safe, stable attachment, children who are abused focus on simply surviving. And that means that they shift the resources that they normally utilise towards learning and development. This combination of ongoing trauma exposure and the reaction to it typifies complex trauma, which features an additional array of traumatic stress challenges. But sadly, the concept of complex trauma was rejected for the upcoming DSM-5, and one really wonders why. Secure attachment relations with attuned, consistent caregivers enable children to internalise self-regulatory functions, develop a sense of safety and trust in the world. But the fundamental betrayal, particularly by a beloved caregiver, by a parent, by a priest, by a soccer coach, and the relational damage a child suffers when that child is repeatedly abused, molested, criticised, raped, and neglected, sets up lifetime patterns of fear and mistrust. And it impacts so much: personal identity, sense of self-worth, relationship with oneself, with others and with the world, ability to manage stress, to self-soothe, somatic symptoms and chronic feelings of helplessness. Really global impacts. So many adults who have suffered childhood trauma develop what appear to be and what are extreme coping strategies, but they develop them as ways of managing their chronic stress, which is often overwhelming. Many of these strategies are adopted in childhood, but they do continue into adult life, where they can be quite less constructive. They include, and they've been mentioned already today, suicidality, self-harm, getting back into abusive situations, dissociation. These behaviours are very challenging, and no one questions that, not just for survivors, but for those who seek to support them. However, if we put them in the context of what's happened to someone, in the context of trauma, they just make so much sense. So when a child is abused or neglected, that child takes on a very inappropriate sense of shame and self-blame. They feel bad, they feel worthless, they blame themselves. And these feelings also often continue into adult life. So even though survivors may want to talk about their feelings, their own shame prevents them from doing so. Also, fear of how people are going to respond, that they're not going to be believed, that they're going to be dismissed. Child abuse at its core is about being and feeling unsafe. And survivors do try and protect themselves as best they can, but often that's by withdrawing, locking themselves away, not seeking help, isolating themselves. When I was in the depths of dealing with my stuff and suffering a really major depression, I spent 2 years basically in bed, and it was only very close friends who'd actually come up and turn up for the day and literally drag me out that helped me. So reaching out to a survivor and just being there and showing that you care is just so crucial. So meeting the needs of survivors can be very challenging for all the reasons we've stated before. Sensitivity to criticism, low self-esteem, difficulties with trust in relationships, substance abuse, self-harming, etc. Never was good with PowerPoints, but it's my way of keeping you awake, so if I'm out of sync, then I know that you're not listening. So did anyone pick it up? No one told me. The good news is that survivors can and do recover, and they can go on to live successful and fulfilling lives. They can learn how to trust and how to feel safe and how to relate to others, how to self-regulate. And the good news is that there's a lot of new information coming out from neuroscience, and it shows us that neural pathways can repair themselves. It tells us all about the hippocampus and the amygdala and the limbic system. But to do that, survivors do need empathy, respect, validation, to be heard, to be listened to. And our current systems of care often fail to respond, ignoring the underlying trauma at the core of survivors' issues and failing to address it. Frequently, the possibility of underlying trauma is not on the health professional's radar, and if it is, it's not viewed as being pivotal. It can all too readily be dismissed and invalidated, and such responses come at an enormous cost, not just to individuals, but to families and communities, and to our entire social fabric. And ASCA, the organisation I'm involved with, witnesses the cost of that every day. Every day on our 1300 line, we receive calls from survivors who feel they've been totally let down by the system. Firstly, they can't afford the care they need, and certainly not for the length of time they need it. They report health professionals who've been unhelpful, disempowering, re-victimised, GPs who are uninformed, didn't ask about trauma despite there being very clear signals that there was underlying trauma, worker who didn't know how to respond to disclosure, a psychologist, psychiatrist, I'm trying not to pick anyone out here, counsellor they felt had minimised, dismissed their feelings, rather than listening empathically and validating them. The principles actually aren't all that very hard. I mean, they're human principles of just being there for one another as human beings. And when someone is vulnerable, to be there to support them and to reach out to them. It's staggering how often survivors are told by those in healthcare environments things like, and we've heard those already today, and I've heard them all personally, and certainly reporting from the clients we see. Such a long time ago, just get over it, can't be affecting you now, you're an adult, you know, get on with it, what does it matter? And these attitudes parallel a survivor's experience of being told to keep quiet about their abuse. When they disclosed, maybe it was ignored and maybe they were vilified for disclosing it. Some workers actually believe that past traumas are irrelevant and self-pitying, or imply that the trauma is the person's fault, that they're making it up, that they're carrying on, they're exaggerating, or that they had a personality disorder. And we've already raised that issue today.